Hi, I'm Laura, and my presentation is going to be on breast cancer. Um, I know you probably all are familiar with this kind of cancer, as it is one of the more common types, affecting about 300,000 females a year. It does affect some males, but most of the diagnosis are women, and this is about a 1 in 8 lifetime risk, and the average age is about at 63, which is a lot higher than I was expecting to see, because my aunt, who was 45, got diagnosed with this a few years back. So I think it's mainly middle-aged women, but also it said the average age was 63. The most common type is IDC, or invasive ductal carcinoma, and that's usually what most women have when they get diagnosed with this. So breast cancer replicates through a process of uncontrolled cell division driven by errors in DNA replication and the cell cycle. This involves most of the checkpoints failing, leading to the cell replicating its DNA and then dividing into daughter cells even when the DNA is damaged or abnormal. And this will come back in my drawing here that I have. So this is the BRCA1 gene. I know we talked about this in class, so here is the little demonstration that I made. So this little thing is the BRCA1 protein, and this is in a normal cell, and it's going to bind to the DNA, the part of the DNA that's damaged, and over here it's going to fix it. It has a little check mark, and so yeah, that'll be that, and then it can go and do all its other things. But for the mutated BRCA1, you have the protein, which is in a really weird shape. It's the same thing, but this is the mutated one, has the damage, and then over here a bunch of damage, and it can't fix it. So the mutation equals no repair, and then mutations accumulate, and then that leads to cancer. So this is also it relates to the P53 gene and some other genes, but this is just when it's dividing with damage, so it's creating more mutations, which leads to more mutations and just cancer. So protein production is essential to breast cancer progression because it disrupts the essential dogma, which we've been learning about. So that's DNA to RNA to proteins, and it leads to the creation of proteins that promote cancer hallmarks like uncontrolled cell division. So this is just creating so many cells and that when we come back to treatment later, I'll talk about that later, but when we come back to treatment, it can't kill everything. So this occurs through alterations like DNA copy number changes, which increase the production of growth-promoting proteins, and dysregulation at every step of the process, including transcription, mRNA translation, and post-translational modifications. So to do with cell signaling is crucial in breast cancer because it regulates key processes for survival, and dysregulation of the signaling pathways such as the MAPK pathways also allows cancer cells to grow uncontrollably and resist death, which leads to the more resistant cells, which stick around after treatment and then leads to the cancer not being killed, so you have to go back and try and get it again. So aberrant signaling can also affect the tumor environment and lead to resistance, making it a major focus for cancer research and targeted therapies, because the signaling, it comes in, it tries to kill it, and if it's resistant, then that's a problem, and it's not really supposed to do that, but with the cancer mutation, it does. So some treatment and prevention strategies target key aspects of the disease's biology, such as the signaling pathways that drive uncontrolled cell growth and the genetic mutations that cause cancer. These methods focus specifically on disrupting specific molecular features that make cancer cells different from the healthy cells. And breast cancer is treated with a bunch of different therapies. An obvious one is chemotherapy, but also with surgery, radiation, hormone therapy, and other targeted therapies which are specific to breast cancer, which can be local or systemic. Prevention also includes, on top of like the surgical and chemical side of it, it also includes like adopting a healthy lifestyle with regular exercise, a healthy diet, maintaining a good weight, and like limiting alcohol. Other measures are avoiding smoking, avoiding or discussing the risks of hormone therapy and birth control pills with the doctor. And yeah, so there are some surgical things that we would usually think of, like the chemotherapy, but also adopting a heavy lifestyle, staying at an average weight and not being overweight. This can also help reduce risks of developing breast cancer in the future. So, yes.